Now then, let's talk a little about this story in the Telegraph yesterday, how within a few years every newborn baby is going to have their DNA taken by the health service so it can be screened for diseases. Is it only me that can see the dark side here? How folk with genetic indicators of disease might be denied insurance, possibly employment, how living under the shadow of a genetic illness from day one on this earth might impact that individual's life as they grow older, let alone issues of data security. We've just heard 16 billion passwords have been hacked overnight, or within the last couple of days. Now, Health Secretary Wes Streeting believes advances in genomics will allow people to leapfrog killer diseases, that we could have, instead of mass screenings, patients offered personalised health checks, targeted medicines to be offered earlier, avoiding adverse drug reactions. Yeah, but it sounds great, but this would assume that NICE, the National Institute for Health and Care Excellence, will approve those targeted medicines, which, from what I know to date, in many cases, are eye-wateringly expensive. And indeed, only last week reported how NICE had stopped the NHS from prescribing the Alzheimer's drug lecanemab because at £20,000 per patient per year, it deemed the life-extending drug too expensive. I've also, as someone who's been gene screened myself for a genetic flaw called Lynch syndrome, I had to be counselled before the process, counselled after the process. And when you get the result, it does affect you. I went from someone who lived in fear of bowel cancer, ate very little red meat and loads of green bananas, to someone now who probably eats more red meat than I should and has eased up completely on the green bananas. Yes, it's got good news elements to it, but there is a dark side, I believe, too. In a moment, I'm going to be speaking to someone from Med Confidential, Sam Smith, but first to Dr. Tony O'Sullivan, retired consultant paediatrician and co-chair of Keep Our NHS Public. Nice to speak to you, Tony. Good morning.
Hello again, Matthew.
Am I being a doom-monger here? The Telegraph published this story without criticism yesterday, which, considering it's a Labour initiative, is amazing.
I think it's really important that you raise some of these issues. As a paediatrician in the past, I'm retired now, you have to welcome the development of the potential for families and children to have early support, better knowledge, potentially curative intervention, and that goes along with the need for a functioning health service that can give, as you said, really important counselling from the word go, and potentially, for some conditions, lifelong support. For some conditions that are discovered earlier, and we already do this, as can be treated fully, like hypothyroidism, which when discovered early and treated, allows the child to live a completely normal life. Others can have early intervention and warnings, such as a child with sickle cell disease, a very painful and important illness, very poorly treated for a long time in this country. And if you find that early and you give the things like preventive antibiotics and education both to the family and to the supporting services, you can really help that child. But it's lifelong support. It doesn't cure. So there are positive issues, as you said, but there are really important ethical and practical issues. And of course, I read in the article that there was a research project started at the end of last year. We need the outcome of that research. What are the ethical implications for families? If you make a diagnosis for a family, will the services be there to support them? It's unethical to make a diagnosis if you have nothing to offer that family.
Gosh, I'd not considered that. That's a... yes, it's literally flagging up something that would have nothing but negative connotations, but you offer nothing to help.
I would hope that would be part of the ethical assessment. But as you said, as soon as the family hear a diagnosis about the genetic implications for their child, there's an immediate change in that family.
Agreed.
There's an immediate level of anxiety, and there are issues of consent to these testings that should be part of the research. What degree of buy-in has the family and society to mass testing of this nature? There are huge other issues, like you said. Who controls the data? We've given the data platform to Palantir, as you know.
Yes, yes, which I know causes many listeners a degree of consternation. Dr. Tony O'Sullivan, really grateful for you joining us this morning.